in the room, they will hear me again. So I'll be very brief. All right. So really glad to be here. What I talked about is some of the things that I work on. Instead of talking, I'll just go straight to what I need to talk about. So I will use my time here a little bit wisely, in the sense I'll talk about. I picked two projects that I worked on, and part of the reason is all the attention that we're receiving these days about anti-vaccine. There has been quite a bit of work already on it. So I'll talk about NLP applications in a very traditional sense for one project where we did, and then get into an application that we developed using generative AI for contact centers. So medical contact centers, although it can be translated into more generic contact centers, but our goal was to develop it something for medical contact centers and demonstrate how generative AI could be used, something like that. So two use cases. Okay, so and what I also mentioned that those who are attending from Zoom did not hear is my presentation is, I was not sure who is going to be an audience here, of course, care providers, but I thought, so presentation is a little bit more academic, and I'm going to skip some of those slides, or like I said, you could tune me out if it starts to get too academic. All right, at least on something. So a couple of my doctoral students are involved in these. One of them is at University of South Carolina. He's a faculty, and the second student, Rishabh Patel, he's doing a PhD, but also he's a data scientist at one of the medical insurance companies. So some of the things that I've worked on AI is my hammer, machine learning, and so various different types of machine learning techniques, and also very different types of data is what I can work on, from transactional data to electronic medical records to network data, which lends itself very well for network analysis, and then get into the text data. So we've done many different things, different techniques, different application areas. Some of the other things, in addition to the healthcare, I do work on misinformation, in particularly in the healthcare domain is what we are more interested in. But misinformation is just prevalent these days, given the generative AI. You can easily generate content, okay, and so detection of those content is pretty difficult. But the bigger question is, do we even need to detect it, or do we need to just work with something like AI assisted generation? All right, so it's a very gray area to work on, and generative AI has really posed a lot of challenges. So that's another big area that I work on these days. Something that fascinates me. Okay, all right. So and of course, sports injuries. Being at Auburn, sports is a big thing there. So we work on injuries and player performance is what they're interested in, but I'm more interested in something precursor to that, which is players need to be safe. So safety of players, concussions, injuries, and those kinds of things, and apply machine learning and AI models to that. So what I'll take my time today is briefly talk about one project where I want to demonstrate, how traditional NLP approaches can be used, and in the sense of not just pure NLP, but actually hybrid techniques. So apply a combination of network analytics and look at it from a different perspective, and using NLP in combination. So I'll talk about that, and the second project that I'll briefly talk about is how generative AI, where again, applications of NLP, generative AI is just one another application of NLP, but how generative AI can be used to transform or disrupt the way the current contact centers or medical contact centers operate. So we have developed a full application for that. So I'll get into that first, but for those of you who are not familiar with network analytics, or rooted in the field of applied mathematics called graph theory, or graph theoretic applications. So you talk to applied mathematician, they will say graph theory, but we'll call it network analytics because we are more on the applied side of it. So just to give you a very quick 30,000 feet view of what network analytics is, essentially, there are two things you need. One is called as node. The other is called as edges between the node. So you look at the world that is complex using that lens. It is you who has to define what is the definition of your edge, how those nodes are connected. You could look at nodes as patients, okay? How are they connected? Maybe they have a common disease, say diabetes or hypertension. Then the two patients are connected, okay? So then they have an edge between the two. So that is one way to look at it. And I could develop patient networks with that and study in many different ways, or I could develop disease comorbidities network, which we have done quite a bit of that. And but that is how you define nodes, and how you define the relationship between those nodes is dependent on the real question that you want to explore, or the problem you want to explore. So it's got a very applied, very attractive field of AI, because it is always supplemented with pretty cool looking visualizations that you might see in media and other trade publications. So that is what I'll talk about. However, what I will do is I will talk about that from the perspective of applying networks to text data. Okay. And so we'll look into that. All right, so this is just another example of a bipartite network where, to give you an example from a business world, where I want to study networks from where two different types of nodes are there. One is say patients, the other is diseases. So which patient has got what disease, I make a connection between the two. Okay, if a disease one, and if a patient one is having disease one, then I make a edge connection between the two. So that type of network where you have two different types of nodes, that's called as bipartite network. And it's a very rich way of trying to develop understanding. You can develop what disease occur together, or understand the clusters of patients that could have common type of diseases. So those kinds of things can be done pretty easily, but a very attractive field of science. And you saw during the COVID time, and people were developing the disease spread, how COVID was spreading. A lot of these techniques were applied to understand the spread of endemic. Like there are algorithms to study in what directions things will spread. All right, so that was my very quick 5-minute cursor. So I'll talk about, this is a study we did some time back, but now it's become all the more attractive because of all the anti-vaccine sentiment we are hearing these days. So this particular study, I will talk in the context of two things. One, the social media feeds, and particularly Facebook, is what we put a lot of data from. And the other thing is related to COVID vaccine, anti-vaccine sentiment. Okay, now there are a lot of other anti-vaccine sentiments that are going on these days, but we want to zone in into one, compartmentalize, at least study one particular context. So to give it a context, so I'm going to skip all that, right? So this is all academic stuff. I don't want to talk about all that. All right, so just to give you a very quick idea, so what do we want to study? Okay, we want to understand that when we pull all the social media data from Facebook, because why Facebook? Because people talk a lot on Facebook. There's more context given. If you go to Twitter or now X, you don't have a whole lot of content. So the context is a little bit devoid. Okay, when people talk more, then you know more about what kind of emotions they're embedded. So we want to understand what are different things that are going on, or talking about different groups. Could we identify, tease out some themes out of those? Okay, and the other thing is there some sort of a network phenomenon that occurs? One example of phenomenon is network-based phenomenon is like 6 degrees of separation. You might have heard that's very common way. Okay, if you and I don't know each other, then we may be connected by separation of 6 people. Okay, so that's just one. Likewise, there are many other social network phenomena like small world phenomena exists. So we wanted to look at it. Is there some sort of phenomenon that's embedded, hidden in that data? Again, and what kind of emotion is going on in these different groups? Are they angry? Are they mad? Are they disgusted? So different emotions exist. So what we did is, of course, we put a lot of Facebook data, and then we tried to identify communities. within those, okay? Like hate groups or people who are just talking about information sharing, or things like that. We do not know. So that's what we wanted to find out. All right. So again, and I'm going to skip this in the interest of take you directly. Like I said, some slides I have just part of academic presentation. But so we pulled the data from Facebook and we kind of studied this during, and we pulled a lot of it. So we had a pipeline through Facebook and we collected a lot of data. We restricted to English language. Of course, there are multiple languages that are there. We do have data for that, but we didn't analyze for this one. And we only restricted ourselves to public. Otherwise, we don't want to hack into somebody's account. So these are public posts that are made. So about these many posts collected from heterogeneous different Facebook groups. Okay, just to give you what we did. Okay, so 3 research questions that I talked about. Each of them kind of the last 2 vertical polls that you see try to answer the question number 2 and 3. And is there a phenomenon? That's answered by the one that's titled network analysis, where I'm trying to identify if there is a small word phenomenon exists. I'll talk about that, what that means, and then get into emotion analysis. I want to analyze the text and particular community. I'm only interested predominantly, although I will find out various different communities of questions exist, but I'm more interested in that hate group that they talk about anti-vaccine sentiments quite a bit. What are they really talking about? Are there certain themes that emerge out of it? And so that way, you understand what is going on there. And this is all, what you see here is sort of a pipeline, the process that we followed, okay? How we defined our network, okay? So let me talk about the first thing, okay? So what we did here, essentially this, I'm translating this figure into these steps, which talk about, okay, first, what I did, I'll make it very simple. Let's say I take 2 Facebook posts posted by 2 different people, and I want to understand and think of them as 2 nodes from a network. If I got to look at from a network point of view, that means message 1 posted by somebody, that's 1 node. Message 2 posted by somebody else, 2 nodes. If the 2 messages are semantically very similar, and I don't want to read them, because if you read them and I read them, there will be a lot of subjectivity. So what I want to do is I want to do some sort of semantic similarity analysis. That means algorithms read it, and I use deep learning based models to look at the semantic similarity, how similar they are. If they are very similar, over 85% similarity, then I say they're similar and I connect them by an edge. Okay, so that's how I get my network. If the 2 messages 1 and message number 5, I find they're not similar, then I don't connect them. So that's how I grew up my network, by analyzing those 7,000 something nodes, okay? And then what I did is I applied my community. There are sort of algorithms that you apply that can detect, parse through the network, and can identify communities that exist. So are there hidden communities? Those are the algorithms you apply to study some sort of subpopulation groups, if you want to detect, if you do not know. And then I would analyze if they 2 occur together, okay? So what I did is I've kind of talked about, I used a deep learning based model, SBER, which is very popular model to detect semantic similarity, because I'm not just looking at the content, I'm also looking at the meaning of those. Even though the words may be different, but if they have the same meaning, then they're similar. So those trained models, large language models can look at that. All right. So this is the heuristic we use, 75% similarity, then we connect, otherwise we don't, and then again, a different method. So let me just take you directly to what we did. I'm going to skip all these in the interest of time and show you this is what we got. Okay. And each dot, it's very zoomed out to show you each node here represents the Facebook message. Okay, 1 node is a message. If they're connected, then you see those lines there. And so that's how we got the network, but the colors are a result of the communities. We identified 5 different communities based on the semantic similarity. based on the community detection algorithms that we run. This is more like running a clustering algorithm on network data. So here's what we found. We found 5 communities, and we kind of, we had to go back and look at the message. We know that they are different from each other. The pink one is different from blue and green, but what are they? So you got to go back and look at those messages and then get an idea what are they talking about. So we found out, okay, that there's one community that's blue, only information exchange is going on, okay? And the one community was just talking about side effects. The other community was talking about the one in the violet is talking about political aspect things going on. And the one in red is what we are most interested in. And that's the one that is talking about anti. So the algorithm did pretty good job in identifying, it could delineate the boundaries pretty nicely. So what do we do next? Now that we have found out, I take that bucket out of my all Facebook, okay, and now I'm going to do NLP analysis on that, okay? The only NLP analysis I did was reading the content to look at semantic similarity and develop my network. Now I'm going to take that bucket, the red bucket, out of it. I know the IDs of the message. I go back, and now I'm going to analyze the content. Okay. So I zoom in. So these are just some examples of what we found. So develop the network. I'm going to take you directly to the one that's political, and the one that's one deals with anti-vaccine. So you can see there was quite a bit of political stuff going on when people were talking about our vaccine-related content. Okay, so that was there. So what we did is we then started to parse through. Now I take all the content in that red bucket, and I break them down into bigrams. That means contiguous 2 words. Okay, all those, let's say I got 2,000 Facebook posts. I break down them into 2 words, okay, that's called as bigrams. And with contiguous, that means there's an overlap, okay. 1 and 2 word in a sentence will become 1 bigram. 2 and 3 will become the second bigram. 3 and 4 becomes, so that's what contiguous means. So what we did is, so we did that. Now, how did we develop the network? If the 2 bigrams appeared in the same message, then there is an edge between the 2. 1 bigram will serve as a node, the other bigram will serve as another node, but if they appear in the same Facebook message, then they're connected. That means they were part of the message. So that's how we develop the network. Now you're going to have overlap of these bigrams across the messages. So that means some of the bigrams will be highly connected. There will be more weight in the connection. So the definition of my network, as you can see, changed. What I called as my network and what I call as my edge, that is the relationship between the 2 nodes, changes based on my question that I want to answer. Okay, so I did that, and we were actually able to develop the entire network. What you see here is just a snapshot view of only 15 top bigrams is what I filtered out. So you can see what is showing up. The bigger the circle, the more that bigram is showing up. The more it is connected, the darker the line between the 2 nodes is showing up. Okay. Now, using this, I could develop a lot of network-based characteristics or features. Okay, centrality, degree centrality, or like a concept of hub that you see, like Delta Airline has got a hub in Atlanta. So I would like to know what is that hub here. Okay, and so that degree centrality, there are tons of different measures of centrality. We did the filtering based on weighted, I believe weighted centrality, and we filtered out some of that. So here's a snapshot view of the message where some of these node bigrams will be showing up. So very descriptive. This is something that we could not really put them into different groups. So we analyzed the network and looked at, which I have not reported the statistics here on those network features. But what you're able to get here is additional features, the network features, which you don't get in traditional prediction and using machine learning. The other phenomenon we wanted to look into is I'll just give you an idea, is a small word phenomenon. So the way to define a small word phenomenon is, very high clustering is there. but the average shortest path length between the two nodes is small. So if you look at the networks, the one in the middle falls under that criteria where clustering coefficient is very high. That means all the nodes are clustered very heavily with each other. That means connected with each other through edges. And but the average shortest path length between the two nodes is short. Okay. The other phenomenon is cultural bridges. Are there certain nodes, or in other words, certain words or bigrams that serve as a cultural bridge in the entire network? That means it is an important connector between many other nodes. You want to identify that. These things can serve as a way to develop detection models for hate, vaccine hate groups. Okay. And so that is that. So what we found, just to show you, what we found is something like this. Okay. So for anti-vaccine, I'm just focusing on anti-vaccine and political. We did find the presence of a small word phenomenon there. So that phenomenon did exist in that particular group. Okay. And on the right, you could see the bridging centrality. So bridging centrality, we didn't find to be existing there because the numbers are so small. Centrality values are so small, but the centrality values, the average shortest path and clustering coefficient of 0.6 and 0.65 are relatively high. So high clustering coefficients and average shortest path distance. So that was something we found and proved to be existing. Okay. All right, the last thing very quickly I wanted to show you is you can see there are many different aspects of emotions. I wanted to understand what is going on in these anti-vaccine hate-based messages that are getting posted on social media and flowing pretty, because they have an influence on people, because people read them and then change their mind. So we wanted to understand what kind of emotion is going on. So we used, again, deep learning-based models that are available on Hugging Face. And let me just take you directly to some of the results, okay? The visual will show you much better picture. The table is on the left. You will notice that in the anti-vaccine group, there is a, and I did summarize those results just so you don't have to parse through this table quickly. So anti-vaccine posts significantly less joy and more sadness is what was observed. Significantly, statistically significant. All right. Then we found that similar thing in those groups. There's a lot of fear is being talked about, and a lot of so very, very high fear-based emotion was they're trying to catch very high on that, and of course the anger and surprise. So some of these things are not surprising, but it is good to get validated what is actually going on. They're not talking about happy stuff there for sure, right? So that is something to look into. Now we can develop AI models that can detect these kinds of emotions, and so this would be the grounding for developing some of those detection models that can detect those hate. How do you do that? You do that using network features and combining sentiment analysis models to do that. So that was kind of one study I wanted to talk about, could give you a glimpse of how I used NLP approaches in combination with another AI technique, which is network, looking at the word from a more complexity science perspective. Okay, and so that was that. All right. So any questions, folks, here before we go on to the next one, or do you want to, Ruben? How do you want to? Okay. Okay. All right. Okay. Sounds good. So I'm going to skip all this, and I'll be glad to share my slides later on. So Dr. Pillay can share and Heather can share those slides with me. So let me just now take the time. This is something that we are currently working on. We have developed the app. So I wanted to show you there's a lot of buzz about generative AI, and I do a lot of work in that space. Outside of healthcare too. So I have that freedom to do what I want to do. So I also look at fake product reviews too. There's a lot of that goes on there, right? You go to buy something and you read a review, and then you get influenced and you buy the product. Okay. However, what you don't know is who has written it. A real person who actually used the product, or somebody who was paid to write a generative AI, use generative AI to write it. Nowadays, generative AI is used to write those reviews, but prior to that, people were paid, and there was a big FDA cracks down on that. Now I don't know, but used to, right? With all the funding cuts, we don't know what FDA will do or be able to. But certainly, it's a $1 billion loss. There is a translation of that. And so Yelp did a lot of that happened on Yelp, and there's a data set out there on Amazon that we have analyzed pretty significantly. We have generated our own fake product review data sets using generative AI and developed models that can beat that. We found that even Google or these fakes, they have algorithms that can beat out those fake, but still they make it through. So we have a study that's under review on that. So anyway, so I'll talk about the one that's we are pretty excited about, which is the healthcare contact centers, because we think this is one area where there's a lot of inefficiency and a lot of improvement can be done in terms of call resolution and the time it takes to resolve a problem. Okay. So especially with the mental health, where if people are calling, they are pretty sick. Okay, so let me just talk about this. All right, so very quickly, you all know this, so I'm going to skip some of these very quickly, zip through them. All right, so medical contact centers are pretty important in the sense they serve as a bridge between the providers and the patients. Okay. And so what do? They provide a support for a lot of different types of operations. So you're talking about administrative, you're talking about authorizations, patient authorizations, enrollment of patients, member support, Medicare, Medicaid, and of course the benefits. Right. So there are all sorts of different calls that come through medical contact centers. Very hard to pin which one, who should be handling which one. Okay, and of course the focus area is what do you ultimately try to gain out of it? You ultimately try to get satisfaction, resolve the call, and sometimes the call takes forever to get resolved because there will be multiple calls. Okay, and the accuracy, because there is a lot of analysis done. Contact centers are evaluated based on that. Even hospitals get penalized for having a low satisfaction, right? So very heavy use now. So this is how it is done right now. Okay, the way it is done is a patient calls. Okay, the guy in the dark calls. The call center person is going to pick it up. Let's assume it's not chatbot. Okay, you're going to talk on the real time, and whatever discussion goes on with the problem will get routed to the right person, assuming. And then the call disposition agent records. While the person is trying to resolve the problem or talking, they are also working. They are doing very heavy multitasking. They are making notes. They are engaging you in discussions, trying to solve the problem. And so they are overloaded. They are multitasking. They make mistakes. And they're inefficient. Okay, because a lot of times the notes are taken afterwards, and somebody else is going to come back and read maybe after 4. They probably have to analyze if it resulted in satisfaction. Somebody will have to hear the recording out and get the whole context, read the notes. It's a very inefficient process. It spreads over a long time. What if somebody who's suicidal is calling, and you're going to take that long to resolve something like that? Okay, so those issues are pretty significant. Only a portion of this happens in real time, where I've drawn this hidden line, right? And rest of it happens not in real time. So it takes a long time to resolve that. So those are the problems, and leads to a lot of errors and inefficiencies. So clearly we saw a pretty big opportunity for LLMs or generative AI to do this. Okay, so I've talked about all of this, the manual call disposition. In the way it is being done right now is manual call dispositions and documentation. somebody either taking it while the call is going on and also doing it later on. Okay, so again, multitasking, pretty significant amount of multitasking. They're distracted, they're not paying attention, and the quality of satisfaction obviously is going to go down because of that. So lack of automated summarization, it is manual process. So if the person who took the call is not doing it, somebody else is doing it, summarization, for billing purposes or for some care provider to eventually look at it, that's a very manual process, very error prone, and a lot of subjectivity there. And the challenges of accuracy certainly are there. All those things are there. So, so this is something that we wanted to address, okay? And we wanted to streamline the call disposition entry and improve the identification of call that need immediate intervention, and perhaps do some automated summarization and apply sentiment analysis to it, so we can figure out what is going on. Is it negative sentiment, positive sentiment? The problem though is all the sentiment analysis models, like the one we used in the previous study, they are trained on publicly available data. Okay, they are not contextualized. They have not been adapted to the domain. So if a cardiology unit wants to use it, they are not adapted to that domain. So there isn't domain adoption. You got to train that data, use that data to provide domain contextualization or domain adaptation. So that is not there. So we certainly couldn't find one sentiment analysis model that's built and specifically for sentiment for medical contact centers. So what we did is, of course, and then the call disposition. Call disposition is something like, okay, you get a call and you're picking from maybe 20, 30 different categories. Where does this call really belong to? Okay, and so that's call disposition. Again, very error prone if the person is not trained very well, and a lot of subjectivity there. Identifying satisfaction. Again, can we do this automatically? Can do it, because again, the person will have to come back later on asynchronously to read, look at the recording, hear the recording, and then rate him, rate that person, rate that call conversation, and there's a lot of noise there too. So what we do there is can we automate this and contextualize it to the contact centers? So anyway, so what we did is again, this is what we did. So let me just talk about the system design that we of our generative AI model that we developed. So let me walk you through this. Now I've got gory details of this, which some of you may not be interested in, because again, you get into deep into some development here, AI development. But I do have zoomed in images of that. Maybe I'll just show you that, and just so you get some appreciation for that. So what we did is, let's talk about this, okay? The audio call happens, okay? The person calls the call center agent, okay? The patient calls, all right? And this is happening in real time. So what we did is, we used, instead of doing something here in the recording, so what I did is, we use Google's Whisper API, which is Google's translation from speech to text, automatic. It does a very good job of that. So we used Whisper, OpenAI Whisper model to transcribe the conversations. Now, you know, in a conversation, there are two people talking, right? And sometimes there's a background noise, okay? Background noise, maybe the television is going on in the background. So you can't just transcribe it automatically. There is a lot of noise interference there. Maybe the noise of traffic or somebody else, or dog barking, okay? And if you run blindly, it is gonna create a lot of noise in your data that you want to analyze. So we had to do we tried a lot of different heuristic approaches to clean the data before we feed it forward for our model. Okay, so we did that. Then what we did after that is that we got the transcript after doing a lot of algorithmic cleaning, and then we created a prompt template that is parsed through LLM. The model that we use is available. So we use Mistral we didn't use Llama or things like that. We could have used Llama too. But we use Mistral. It's very easy to work with, and it is available on Hugging Face website. So we use that, and we parse the model output into a SOAP format. So subjective, objectivity, assessment, plan. We were able to tease out that content which is related to subjectivity, objectivity, and plan and assessment from those conversations and fit it into a structured format and summarize it. And not only that, we were able to do some sentiment analysis to that as well. So this is a zoomed in view. Oh, the step 2 is divided into 2A and 2B. What we do is, the first thing we do is, using the LLM models, we parse through all the conversations, okay? And we are able to match them to one of the 18 categories of call disposition. And I have those categories that I'll show you in a second. So we were able to do that automatically on a real-time basis without any human intervention. And second thing is the stage B, which is where we were able to parse out from the conversation transcript all the subjectivity, objectivity, assessment, plan, and primary reason for the call. Why were they calling? Were they suicidal, or they some healthcare insurance related stuff, or pull other notes and do some call identification automatically. So that was very useful because it saves a lot of time for everybody. And finally, what we were also able to do is train our own, the step 3, we were able to train our own sentiment analysis models that were contextualized, domain adapted for medical contact centers that are not available. So they do a much better job than anything. So this is like a zoomed in view of what you see here in step 1, what we actually did. And I'm not sure if you guys would want me to go over a lot of this stuff, but I will leave my slides here. And so you can see all the different things. This is more like a system-based implementation of how we got what we needed, the clean transcripts from those conversations automatically. And these are like 18 different call dispositions. So you see the step 2A right on the upper right corner, call disposition. So every call that would come, we would be able to match it to one of those 18 predefined categories using LLM models. So that's a great application of LLM. So if you're thinking, how can we really integrate that in the healthcare? You hear a lot of applications about Q&A, right? Fine-tuned models can be created. Then this is how it looked like, our interface. This is the transcript, how it will look like. And that's what our application will give on the right side. So somebody is not reading everything and scratching their head for 5 minutes. Instead, I'm able to look at what is the main concern. So I was able to pull that. LLMs were able to do that, and they did a very good job of it. And we are doing some validation of that. So you can see description of the subjectivity. So subjectivity, assessment, objectivity, and plan. And then and what was additional relevant information that doesn't fit into any of those 4 categories, we were able to write it down into the other one. So that's that. And then the sentiment analysis part, what we did is we were able to take the call transcript, okay, process it using segmentation and our own custom and tailored our sentiment analysis models. And this is what you will be able to get as an output that you see on the left side. Okay, so the transcripts, and I could also go back and trace it to the original transcript. I would highlight the relevant stuff of that was okay. If they were talking about positive sentiment, or they were happy or not happy, they were satisfied or not satisfied. Okay, overall, I could get a score out of that. Was the call leading to satisfaction or not? Now, so that's what this application really does in the background. So I'm going to skip all that. That's just the validation we are doing for the app. It's not quite done yet. But so in the interest of time, I'm going to skip all of these. This is something we're trying to develop. After the call, traditionally, there were surveys that were done. I tell you, can you imagine the response rate of those surveys? 1%. Every 100 person who's being asked, only 1% responds. So have those surveys. So what we're looking at is looking at those 4 questions that you see here is, was the problem resolved? So this is like post-call survey. And so people would respond maybe 1%. So we took that data, we factored this in, and we looked at, are the questions correlated? Okay, and we factored this information into training our custom sentiment analysis models. Okay, but anyway, so I'll skip that, and this is a custom trained model that not only looked at the content, the transcripts, but also looked at the post surveys. So we provided some additional input to that. All right. Anyway, so I'll skip all this in the interest of time, but you can see how we did some statistical analysis. That's just the algorithm part. And that's all I have the fireworks for you talked about without overwhelming. And I kept a lot of gory details that I would keep for a journal publication out of this. But kind of wanted to show you how this can be done and look at data in a different way where you can develop different types of AI models and use different approaches for that. So, well, that's it.
Let's put the camera back on.
Yeah. So camera was actually not working. So the only way you can see, let's see, stop the screen share, then I think the camera will show up. And I think you will have to maybe stand here for you to be able to.
I can see that. Okay, guys, so any questions? Really interesting. Yeah, so really interesting, actually.
Yeah.
Two fascinating studies, and obviously a lot of application to healthcare. Any questions? Those in the room and virtually?
Yes.
On the Facebook analysis for the visualization with the colors, was that just for effect, or did?
No, this was developed by algorithm. So the
Right, but with the way that you had it on there, that was a direct visualization.
Direct.
Okay,
yeah,
so then
screenshot of the algorithm.
I noticed there was a lot of, like, green was kind of down here and one
Yeah.
was like in the middle. Is there any,
So
did you find any correlation with why they were clumped?
So that's how the community. So if there are some layout algorithms that are applied on these to make the visualization make sense, and so those visualization algorithms, they called as layout algorithms, were applied on the raw data, and so they're arranged. If 2 nodes are could be here or could be there, may not make sense, and so.
There could not, okay, so there
Yeah.
may not be correlation with.
So
With how it showed up, it could just be.
yeah, the correlation is because of how dense the network is.
Yeah.
But that was not visible because there were so many nodes. Now, if I take a snapshot view, then yeah, you'll be able to decipher that, or completely zoom in maybe into different sections.
Gotcha.
But so there was no human intervention involved, so I didn't do any aesthetics of beauty, applied any beauty products to that, but just the community detection algorithms do this. They try to iteratively pass through the data to identify communities and apply colors to that.
I thought it was interesting how.
Thank you.
Hey, Sam, go ahead.
It's just like you had connected communities, but even though they were, far apart, they still had those edges that connect them.
Yeah, some of
Maybe
those
some
nodes
sort of
were,
outliers.
yeah, some of
in
those
places.
nodes were quite far away from each other. So could be just an artifact of the algorithm that is running on it. So.
Sandeep?
Yes, can you all?
We're muted. We don't hear you.
We have sound.
We don't. We don't
Here's one
hear.
question in the chat. I think.
Okay, all right, let me see. All right. Hi, Sandeep. So my question would be, what is the accuracy of call summarization and Whisper AI? So there was a lot of Whisper AI was used to create transcripts, and it was not very good. It did a lot better than many other APIs out there, but this was better than on all others. But after that, we had to apply quite a bit of heuristic algorithms to clean the noise out of the data. So before data becomes usable, we had to go through manually, that was the human in the loop part, where we had to go back before we can deem the data to be useful. We had to apply quite a bit of heuristic approaches. So that was that. And the accuracy of call summarization was actually pretty good, and way better than what humans were doing. Okay, now can I say that statistically speaking, we have to conduct an experiment on that? Yeah.
Okay, Sandeep, hope
Thank you,
have to go
Rajesh.
ahead. If you have a follow-up, you can put it in the chat to
Yeah.
Rajesh
So,
Khanna.
Rajesh.
Regarding emotion analysis
Yeah.
from Facebook content, what are the attributes it is looking for in detecting emotions?
Okay.
It is based on text, so it can be error prone, right?
So is it based on text or is it based on error prone? So look, there are many. So thank you, Rajesh. So there are many different. The people work on emotion analysis for many years. There was a very traditional way of dictionary-based approaches that were used for sentiment analysis. Okay, and they're all sort of very outdated now. And now I could use pre-trained models like Roberta deep learning based pre-trained LLM models, but they're not trained on contextualized on this. They don't always understand they don't always, yeah. So they don't, okay, yeah, now you can see me. So I was standing behind the computer and talking. So they don't always, so little unusual. So they don't always understand the specific terms that were getting used. So we had to train our own models using existing transcripts for that. And the framework that we use is, there are different models. There's one very popular models, and the people who work on, psychology, and you, including you, right? There are 8 emotions versus 28 emotions, right? So we stick to the 8 emotions. We thought 28 different emotions. That's too many different categories. Okay, so, but that's something that can be done as well.
Yeah, I think 8 may be safer, if you can hear me.
Right? Okay. All right.
Well, at least we can hear you guys now.
Yeah.
Joyce, if
Yeah.
you,
Thank you.
your question, Joyce? We can read it, but we can hear you now, so you could just ask the question.
Hi, good afternoon. I am new to this world of AI, and I am just curious. I'm a PhD student working. I would like to include this in my studies. And I'm wondering, is there any work being done for nurses' workflow using generative AI in the hospital setting? I'm particularly interested in using it in the nurses to improve the efficiency of the nurses' documentation.
So there was a paper that I came across that was published in Lancet Digital, and where they did a great job. So Lancet is, Lancet Digital is a very prestigious journal, and so they did that study on physician notes, the efficacy of using LLMs for generating physician notes. So I'd love to forward that paper to you if
Yes.
but there are some, I've come across mixed results in a couple of other studies. So a couple of other groups have studied that in ICU contexts and how LLMs are getting used there. And some people have said positive, others have said negative there to it. So you have to take it with a grain of salt there. I think you need a collective body of research before you conclude something. But a lot of efficiencies are there, certainly in my mind.
Yeah, but Joyce, I think that's an astute observation, that
Yeah.
there's really a paucity of
Yeah.
work that, specifically looks at nurses' workflow. Predominant publications out there related to physicians, so there's really an opportunity for you to do that. If you're at UAB, reach out, and we could also support you in doing that as well.
Thank you.
Any other question? Go ahead. Sandeep?
Yeah, I just have one last parting question. So, Ashish, I know this could be the question where you cannot answer, but I think what are your thoughts on the privacy or ethical part of this summarization tools? And are you actually asking for content, the
Yeah,
consent from the
so
patient
yeah,
themselves?
so I tell you, so whenever I demonstrate this outside of hospital settings, the names get pulled up, right? Right, the data has to be HIPAA compliant. So the real version, I can only show in the hospitals to the patient, but when I'm giving a demo of something like this, what we did is we created using these same LLMs, we created synthetic data, right?
Gotcha.
And so we use synthetic data to showcase these examples there. But it is a big challenge. So take it outside now. If I'm developing the same LLM for generative for say other call centers context, not medical contact centers, then I don't have to worry as much about, right? But who is using it? It is getting used by the call centers. So they have a clearance when they look at these because they would have looked at it anyways as the
Do they
call.
have to do they have to disclose that they're using AI before the
So this
starts?
has not been implemented. We
Okay.
are right. So I know certain insurance companies are talking about they're jumping into this because they see a lot of opportunity there, right? Where people are making calls for medication adherence and those kinds of things.
Gotcha. Thank you.
So,
Thanks, Sandeep. And Melinda?
Yes, thank you. So for some background, I work in digital health. And so all of the messages we receive are in writing. So we don't have to worry about background noise or interpreting voice messages. But we have health coaches and then also dietitians and diabetes educators. So what I'm really interested in is finding a way to take messages from patients that could be something that the health coach can handle is within their scope. Or if the message is complaining about some issue they're having with the app, that needs to go to our support team, or if it's directly related to glycemic management, that needs to go to the specialist. So is there anything, not necessarily specific to diabetes, but not so much for urgent triaging like in the ER, but for triaging written messages that you're aware of that I can read?
So thanks, Melinda. So that's a pretty good question. So I'm not particularly have come across, or maybe we dig a little bit deeper, then we'll probably find it. And the research and work happening in LLMs has just been mushrooming like crazy. Journals are just getting swamped with a lot of these kinds of things. But you saw what you're just talking about is actually a application of a subset of application that we developed, right? Where we created a transcript. And now we have a transcript and we are trying to match it to call disposition that I was talking about, 18 pre-identified categories. I was
Right.
putting the summarization there, matching it, and then this can be sent to somebody else based on that match, right?
Yeah, very
the
similar to
application is
that.
very much a LLM-based application. Whether it has been applied for triaging, that I'm not sure, but certainly some don't find it, then this is doable, very doable technically.
Thank you.
Well, thanks, Melinda. Thanks, Joyce. Really good. Sandeep, are you aware to answer Joyce's and Melinda's questions? If those solutions exist, they don't sound too
Yeah, I
difficult.
know some tools that can do it. I can forward the information. Yeah.
Okay. Okay, folks, we're at 1:34, so I think we're done. I just want to, thank Ashish for one, making the trip, and two, for a fabulous presentation. Thank you all for attending. I want to remind you that if you're really interested in pursuing AI in medicine or nursing or healthcare generally, please go to the MHIBI website, and we have a host of programs that will accommodate your specific needs. Thank you, guys, and have a good afternoon. Ashish.